when your phone
Hey
vibrates.
everybody, welcome today. Today we're going live on, today we have a panel for you. We have some top functional medicine physicians and nutritionists, and we're going to be blowing the lid wide open on food sensitivities. Are they legit related with certain symptoms, certain diagnoses? Are they real? Well, today we're going to blow the lid wide open on that. Here we go, everybody. Hey, everybody, I'm Maggie Yu MD. I am a functional medicine physician and the creator of the Transform and Transform system for turning around any chronic disease. Today, I want to welcome all of you guys who are watching. Many of you guys are watching in from YouTube. If you're on YouTube, say hello. I love that we're live on YouTube as well as Facebook and in LinkedIn as well. And if you're an alumni and you're watching or you're in any of our programs, I would love for you to type in chat alumni. I would love to know what's going on with you. So today we are really going through a series around food sensitivities and food related reactions. How many of you guys know that you react to food? You eat food and there's a reaction. How many of you have gone to an allergist, a GI doc, and have been told you're fine, your testing is negative, or there is no testing, right? So in our Transform programs, which I created, we have a system called the Food Mapping System, which actually clearly identifies using data, your data on exactly what's causing your food reactions. And recently, we opened up access to the Food Mapping System with our new program, the My Food Mapping Masterclass. And over the last month, every single week, I've gone live, and I've gone live with several trainings. So the first week we went live a couple weeks ago, right around Christmas. We did a live on what is the difference between food sensitivities and the food mapping system. On last week and the week before, we did a live with a live panel of clients, patients who've experienced a ton of food trauma and food reactions, and what was their experience and what were their results with going through the food mapping system. Today, we got something special in store for you. We have a full panel of functional medicine providers that are going to be on, and we're going to give you the lowdown behind the scenes to really understand what is the training, what has been our experience, what has been our own medical experience with our own medical health that brought us to really our training, understanding, learning, and our delivery of the food mapping system. So without further ado, I'm going to go ahead and introduce our first guest. Our first guest is Kathy Ryan.
Hello, Dr. Maggie.
Hello. I would love for you to do a quick introduction, Kathy.
Absolutely. So I'm Kathy Ryan. I am a registered holistic nutritionist, functional nutritionist, and I've been working with Dr. Maggie since 2019.
It's been that long?
What's that? Yeah, it has been that long. I know, it feels like forever. And I specialize, I've been working in this industry since 2009. Oh, we've been working together since 2019, and I've been a functional nutritionist since 2009. So 15 years now, and I'm just really happy to be here. I specialize in hormones and chronic diseases. So here we go.
I love it. Next on board, we have Dr. Jason.
Hey, thanks for having me on this panel. I'm so excited to be here tonight and what we're going to chat about. I'm Dr. Jason Bradley. I am a 20+ year veteran of functional medicine. I feel like
Dude, you got to stop aging me and you here.
I know. I feel like I've been there and seen a lot, but I am so excited to be here with Dr. Maggie. Learned so much working with her, and I'm just excited to share what we can tonight.
Dr. Bradley's training as a functional medicine provider has been naturopathic medicine and chiropractic medicine. And then finally, Allie. Make sure you're unmuted.
Let's try that again. Hello. Hello. Hey, everybody. I'm Allie. I am the Transform Nutritionist. I've been with the team since 2021, almost 3 years.
We have an anniversary coming.
We have an anniversary coming. And I've been in this world, in the functional medicine world, since 2016. I've been a health coach since 2012. So like Kathy, we've been at this a long time. And my specialty is chronic illness and working with people with autoimmune and chronically ill folks and helping them find relief.
So today's panel is really behind the scenes. So I I love the fact that we're going to provide our perspective, because when people are talking about food reactions out there, there's a lot of misunderstanding from the medical world and even in the functional medicine world. Whether you're a functional medicine doctor or nutritionist, there's a lot of pitfalls along the way. So I want to give people a behind the scenes of like really what is in our experience, what got us here. I would love to first ask, in your training to become a functional nutritionist or doctor, what do you feel like it has been for diagnosing and treating people's food sensitivities accurately? Jason?
Yeah, I can speak to that. I can tell you that, having gone through 2 core, physician level programs and having spent a couple decades here, there is no training in the core program. There is literally no training. Providers are left on their own to figure it out. A lot of that figuring it out is just trying to guess what labs work and what they mean.
Yeah.
Some of the training most of the training that you get is from like a lab rep, and they're not really trained even in how to interpret the labs. I mean, there's so many problems. Again, providers are not prepared to even take a look at this.
From a nutritionist standpoint, Kathy and then Allie, like what do you guys think? You came from different programs for functional nutrition training. How is your training like?
To be honest, same thing. We didn't get any training. And in fact, I refuse to bring in any kind of food sensitivity training into my practice, because anyone that would show up with a food sensitivity test and come see me, it was like lit up like a Christmas tree. I didn't even know where to start with them. And so I just assumed that they were not real. Like I didn't know what to do with them. I didn't find them accurate.
Well, let me clarify that. It's not that you thought that their food reactions weren't real or that their food sensitivities or allergies weren't real. It's just that you thought the results from those tests were not real because they were unreliable.
Yeah.
Correct?
They were unreliable, and they would have to be off every single food.
This is the standard of care, folks. And what about you, Allie?
Yeah, well, I was trained in a lot of different diets and a lot of different elimination diets.
Mm-hmm.
And so that was a place to start. And also that was a place where it caused a lot of agony for clients, a lot of misery for clients. And that's not my objective when I'm working with somebody, is to see how miserable I can get them in service of their healing. That's not the way it needs to be. That's not the functional way. Mm-hmm. And then, of course, Dr. Jason talked about this, all of the different labs. I attended so many different trainings from labs, and they're all right? And so it's really confusing if everybody's saying, no, this is the one. No, this is the one. No, this is the one. And you're learning from the actual lab. So there's bias there. And so it's like, how are you supposed to discern what's the accurate information? I don't know.
Well, this is interesting because right before we went on live, you mentioned that one of the most common thing lab companies that you train with, we're going to not name the brand. It starts with the letter A. And I have had a lot of experiences with people coming to me with those tests, and even having tried many of my clients early on with that test. What was your experience with this most popular test, Allie?
A lot of overwhelm, a lot of everything. I have to get rid of everything. And it's like, yes, I think that we do. No. And it's not true. And that's it's disappointing and also freeing. Actually, when I learned about the food mapping system and learned all of the steps and all of the, wow, is that freeing for people to realize this was completely inaccurate and you were suffering for no reason. Let's bring some food back.
Dr. J, what was your experience with that test and other companies that you've used in your practice before?
Yeah, well, for that particular test that shall remain nameless, I actually did a promo spot for them. I got sucked in deep.
Shame!
I know, it's shameful. It's shameful. It didn't last very long because, again, like Allie was saying, you get the results back and they're just completely, nobody can eat anything. And then you're left with, a whole bunch of different types of testing that's out there, whether it's IgG, IgA, E. And then you have all these different companies that are just promoting that their version of it is the most accurate version. And the reality is most of those companies are startup companies. They don't have a lot of lab data. They don't have good quality results. They don't have good reproducibility. Yeah. And so when you start looking at, that, it really narrows it down to a handful of a couple of companies out of hundreds that are out there that are even worth looking at.
Well, here's the interesting thing, and I agree with you. I think in my experience, I tested I tested 42 different test companies' tests on, and I've at this point done over 10,000 of these tests on different clients. And I myself and many people have been like guinea pigs, tried this brand and compared them. And there is no, you can't compare, like they're completely opposite or different and confusing. And here's another interesting thing. Even when there is, let's say, to me, like, let's say there's one or two companies that are doing good testing. There's a science. I'm going to explain to you guys the science of what makes a good test is that a big part of the thing is it's called antigen source. Is where are they sourcing that allergen from? And what I learned about how these companies, 99% of these companies are sourcing the antigen source, it is so inaccurate. No wonder we get results where people are really overcalled. Now, here's another experience I have. We do run the best test. We do run a test that over the years I have found is the most reliable. And even utilizing the tests that we do, the interesting thing is doctors are being trained by the reps from these lab companies. The reps for the lab company for the tests that we use don't know what we know at all. They actually, and the reason is they're not delivering care. They're not clinicians. They're laboratory salespeople, right? Who are not delivering care and seeing the patterns that I've seen. For this particular lab company that we've worked with on the testing that we currently are doing, I've done over 6,000 of these. And so I see patterns that reveal some really hidden clues. And and this is a question I'm going to ask you guys, which is, as you guys have all been certified and trained in the food mapping system, and you guys are working with clients on this, what are some clues that you've learned from our testing that you're sharing with clients that was never taught to you before?
I think, first of all, to jump in there, I think that I just want to talk about the training just for one more second. The training is literally, if someone has a severe reaction or sometimes a moderate or borderline, avoid that food. And that's as deep as that training goes. There is no further training at all. So I just want to say that. I think that one of the biggest pieces that's jumped out at me, having worked with, Dr. Maggie and the Transform team, is that it really is it's a complex system. It involves digestion and histamines and regulation and, the microbiome and a whole host of things that are going on in addition to just what's the food that you're sensitive to or reactive to. Yeah. And that's something that's really hit me differently than I've ever been taught anywhere else at all with all my training.
Yeah. Kathy?
Yeah, just going back to the question that you asked, the one thing that really stands out to me, there's actually many of them, but one of the things that I love is that you actually can tell your patients if this egg allergy that pops up is real or not. Yeah. Because not all egg allergies that show up on a test are real. And there's a reason for that.
Most are fake.
Yeah.
Well, that's the thing is that's what I call a false positive. And even on the best test, there's something called a false positive. There's still a percentage, but I've been able to tell which is a false positive and which is a real positive. And I've taught you guys how to share that with clients, and I teach clients how to do that. The company doesn't even know this. They think it's all real, those fake positives.
And the cool part is it's not your witchy intuition that's figuring this out. This is actually science.
It's
right?
data.
Yeah. Absolute science, absolute data.
There's hidden clues in the data that actually can discern what's a false positive and what's not. For example, an egg. Allie, what about you?
I was going to say egg, but this is the functional way in that it's not like you always have to have context. And it's funny when we watch you do a review with clients and then you ask a follow-up question, they already have the answer that you thought could be the reason why, the backstory, they have that answer. And so that's the functional ways where we're digging through. And that's really evident when we're reviewing the food mapping results. And so things like for instance, the almond comes up so often on folks who are newly gluten-free. And they're like, what? How can it be almond? I eat it all the time. Right? I eat it all the time. The follow-up question is always, when you went gluten-free, did you switch to almond everything? Well, yes. Oh,
yeah.
Right. And so
But that being said, this is the folly of elimination diets. So I'm going to break into this section about how, the standard of care currently in functional medicine, naturopathic medicine, working with patients, and even IFM training physicians right now on how to deal with people with food reactions is just eliminate. Here's the problem. If you eliminate something that's a huge part of your diet, you got to replace it with something. And if you don't have data on the replacements, whether you're allergic to those or not, what's going to happen? You don't improve or you get worse. How many people out there have gone on an elimination diet with all the best of intentions, only to have no results, short-term results, or be worse? And I'm going to ask all the alumni that are watching right now that are in the audience, how many of you found out through the elimination diet that you did, and then when you did food mapping, found out that it was actually one of the items you were told not to eliminate that was actually, in fact, your biggest culprit? This is the problem with elimination diets, because it is not based on personalized data for you. And when you eliminate large swaths of food, you have to replace it with something. And even if something seemingly healthy like broccoli is the problem, and you're like, I'm eating tons of broccoli and I'm doing great. What if it was broccoli? Right? And Allie's referring to the almond. A lot of people, when they go gluten-free, I should go gluten-free, then they replace it with a lot of almond products. And that frequently is a culprit for that person. They didn't even know because they don't have the data. Kathy?
Yeah, that is actually my personal experience.
Yeah.
I went gluten-free, dairy-free. And because, I had some inflammation, and I just thought, you know what? I'm a nutritionist. I know that these things cause inflammation. I'm going to get rid of them, and I'm going to go gluten-free. Well, what I didn't know was that I had an actual pretty serious corn allergy. And when I went gluten-free, almost everything that's gluten-free has corn in it. And I ended up with such incredible neck pain, which I never associated with a food allergy, because I wasn't in pain all over my body, but debilitating neck pain that I ended up going to a chiropractor for years to try and fix. Nothing was fixing it until I finally did that food test, and whoa, look at that. And within weeks, days, my symptoms, my neck pain was gone, and it's never come back.
Before you jump in, hold on one second. For those of you guys that are watching on YouTube right now, make sure you click subscribe to the channel, give us a thumbs up, help the algorithm out. If there's anybody that is watching right now, you're like, somebody I know needs to hear this, put their name in the comment section, tag them. If you're on Facebook, tag them in it. And then I'm watching all the comments here, everybody. If you have a question for any of our panelists, go ahead and type that question into the comments. I'm getting it from all the different sources. We're going to pop it up and we're going to be answering it live. So feel free to light us up in the comment section. Now, Jason, you have next, and then Allie.
Yeah, I just wanted to, kind of take it the same kind of vein, Kathy making changes and going to corn. You mentioned somebody eating broccoli, and maybe that's the issue. The other thing that I really see is people really do. I mean, people want to be healthy. I mean, people are really struggling and trying to be healthy, making all these decisions. One of the big culprits that I see coming out are protein powders, right? People jump into, whether it's whey protein or pea protein or fill in the blank protein, and they're just consuming it in gobs, and they don't even know that their body's responding to it in a negative way and causing those inflammatory reactions and maybe leading to some of those chronic symptoms. So yeah, I think that even some of the best laid plans of mice and men, so to say, things fall apart without planning.
Elimination diets is a big problem, and I've done many videos on that. Allie, you're about to jump in.
Yeah, about elimination diets. They're supposed to be temporary. And how many people do we have come into the program who've been on these diets for 2 years, 3 years, 6 years? And so they've eliminated whole food groups. They've eliminated all of these nutrients from their body. They are nutrient deprived. They're nutrient deficient. No wonder their hair is falling out. They're having chronic pain. They can't poop. All of these things. It's a therapeutic, like when we do elimination, it's a therapeutic diet for a finite amount of time. It's not supposed to go on forever.
So here's something interesting. Terry H, coming in from YouTube, says any symptom could be related to food. So I think there's a big misconception out there, because here's the deal. How many of you as patients know that you're reacting to the food and you think, which doctor am I going to see for this? You go see the allergist and you see the GI doctor, and they say, no, it's not your food, right? And my thing is, let's talk symptoms for a second, right? Most people think if I'm reacting to food, it's going to be a GI gut related symptom. I'm going to get gas, bloating, heartburn, diarrhea, or constipation. Okay, how many of you guys get those reactions? Type in chat. Here's the thing. Many people do get those. And a lot of people call it irritable bowel syndrome. And a lot of people go to their GI doc and the GI doc is like, nah, it has nothing to do with food. Because you know what? They're not specialties in food reactions or food allergies, right? So they say it has nothing to do with your food. And so that's a problem. Here's the other problem. The non-obvious food sensitivity related symptoms. What are some non-obvious related symptoms that you've personally had or you've seen other people have that are absolutely related to food, but yet patients are going to get poo-pooed? The doctor's going to poo-poo them. Jason?
Yeah, there's so many, right? Ranging from AI flare-ups, autoimmune flare-ups. One of the biggest things that I see, just kind of recurrent when people have exposure to, foods that they're sensitive to, is pain. Kathy mentioned pain, in her story. I hear, joints swelling up, muscles being sore, headaches coming on, certainly brain fog, fibromyalgia, chronic fatigue, POTS, cardiovascular issues, MCAS. The list goes on and on that could be food related. So Terry nailed that in that comment, just about anything.
And I've shared my own personal experience in the program as well, which was that for me, I remember when I didn't even realize that I had chronic urinary tract infections that would land me in the hospital. And I was so resistant to all the oral antibiotics. I would have to have IV antibiotics. This went on for 10 years. And I didn't even figure it out until I had to go gluten-free for my food sensitivities. And I was accidentally exposed about 6 months later. And I immediately had a urinary tract infection. And I literally had to call the restaurant that I had dinner at the night before. And I said, that blackened catfish, was it gluten-free? And you told me it was gluten-free. And they're like, yeah. I go, do you make the spice or is it on a bottle? And they're like, it's in a bottle. Can you read me ingredients? Right. And there was flour. Right. That's when I was like, oh my goodness, chronic urinary tract infections, gluten sensitivity or food reaction, bingo. And it changed my practice. Every woman or man that came in with recurrent urinary tract infections now, I always go through, what are the food sensitivities? And that's how I've eliminated most of these people's urinary tract infections. And who knew that your recurrent urinary tract infections was related to food sensitivities, right? That's my experience. What about you, Allie?
Hormones and weight gain. Hormones and weight gain. This happened to me because I didn't think I had any food sensitivities, but I had this weight gain that was really making me insane because I'm a nutritionist. I'm a fitness person. Like, why is this happening? I don't understand. Went and did my food mapping and lo and behold, the whey protein that I was having to support my muscles was actually causing severe inflammation in my gut. And, a couple of other things, take them out, down 6 pounds, like magic.
I had a really good question here that Robin had brought up. And the question Robin brought up was, what's so different about the food mapping system versus just going to get a test for IgG testing for food sensitivities? Could any of you answer that? Because I actually did a video training all around this, Robin, which is food sensitivities versus the food mapping system. But in a nutshell, you guys have been instructing and working with clients with this. What's the big difference between the food mapping system? Jason, Dr. J?
Yeah, I can speak to that. I think, pre-working, with you at Transform and the team at Transform, I think that I was mostly just eliminating. I'll just be super honest about that. I was one of those guys because that's what we were taught to do. What I understand now is that it's a system, that it's not just the food, it's the way we're digesting the foods. It's the way that our body is processing and metabolizing out histamines. It's about, microbiome balance with healthy probiotics. And there's so much more built into, just nutrient density. There's so much more built into just eliminate this food, right? And getting clarity on that. It's the whole digestive process and it's the whole GI tract that I.
Well, and it's just even the symbol. I created the food mapping system, everybody. And when you look at the symbol, the iconography around this, on the very left upper corner is the digestive piece of this. And I am already going to tell you guys right now, and I've said it before, I'm going to ask everybody who's been through the food mapping system, who's in chat right now, to tell me How many of you realized through the food mapping system, when you went through to understand every different type of reaction you were having to food, realized that many of your symptoms and reactions to food wasn't even allergic, that it was digestive? Parts of your digestive system was broken, and as a result, you were reacting to the food and had nothing to do with food allergies, which would be just the IgG tests that we're talking about, right? So digestion is a big part of this. On the right upper corner, we see here the food mapping data. And we just alluded to the fact 99% of testing out there sucks. So then someone can say, I did an IgG test with one of these companies we just talked about, and the results are useless and erroneous. So right testing also matters. Not all IgG testing is created the same. In fact, 99% of them suck, right? So right test really matters. And then on the left lower corner, Dr. Jason was talking about histamines. So there's all these different pathways that histamines are involved with. And I think this is actually really interesting, just a reminder of what we've talked about before. Food allergies, you see these food particles hit these cells called mast cells. And a lot of people think they create histamines and it only creates allergic reactions. And then if you actually look at what histamines do throughout the body, can you see how now that it's responsible for pain and inflammation? Can you neuropathy? Can you see how now with people with POTS and dysautonomia, it can impact your blood pressure, your heart rate, with your cardiovascular system, central nervous system? How many of you have autism spectrum, ADD? How many of you have depression, anxiety, brain fog, Parkinson's? And now realize, oh, food allergies can have to do with those symptoms. So like and then uterus over here. So you can already see also that, like Ali and Kathy's talking about, the food and these histamines really impact on your hormone balance. So those of you that are having hormonal hell, guess what? It's food allergy related. So for me, we have to take a really big picture approach to say, where are we going to go beyond just bad, shitty testing or elimination diet? How are we going to address digestion, accurate testing, all the different pathways that these histamines go to affect many different body systems? And then eventually on the right also, why are so many of your nutrients depleted and you're an empty bucket? It's because all those pieces aren't taken care of. You're not digesting it. You have tons of food allergies that are causing literal war zone in your gut. And then as a result, this whole blue bucket here on the right, freaking empty. And that's why you feel so shitty. So there has to be a whole systemic approach to this beyond elimination diet and shitty IgG testing. Allie, you're about to say something.
No, I'm agreeing with you. I'm all in.
Yeah, because so I just want to show you guys why the system, the food mapping system, and my food mapping masterclass is a completely different systemic approach to just crappy testing, just so you guys know. Did any of you guys Kathy, go for it.
Yeah. So the other thing that I wanted to add too, which you didn't really touch on, is the education piece, because there is so much education and background information that we tell our patients and our clients that is not readily available. For instance, I wanted to just come back to like something that Ali said. Oftentimes people will say, oh, well, is almonds showing up because I'm eating a lot of it, right? They think that because they're eating a lot of it, it's showing up on the test. Well, I don't know, because, you know, there's other things like koala nuts and ginkgo nuts that people react to that they are like, I don't even know what a ginkgo nut is. I don't know what a koala nut is. I have never seen this before. And we see this all the time. People react to foods they've never, ever ingested.
Before Dr. J jumps in, I'm going to tell you guys something, right? So I hear doctors, and it irritates me, where they tell patients the wrong information, even pre-test. They say, well, in order for this test to be accurate, you have to eat everything in there, die 10,000 deaths, and then maybe you'll get accurate data. And I don't understand that, because it's not true. And Kathy's bringing that point up because we see people who've never eaten a chestnut in their life and they have a chestnut reaction. That is 100% real. So the accuracy of the testing that we do is so important. And we also don't tell people erroneous BS to tell you to eat everything so that you sick and die 10 times before you actually get results. That is not accurate information that is needed before someone get accurate testing results. Dr. J, you're about to say something.
I was just going to go on the other side of that coin too. I mean, with the argument, you know, oh, if you eat a lot of it, it's going to show up as positive. We have we've ran thousands of tests. where people eat a lot of a certain amount of food and it doesn't show up as positive. You know, so it's not like a one-to-one there. You know, I mean, people are reactive or they're not reactive. It really doesn't have to do with the amount that they're consuming.
So here's another, Allie, go for it.
Well, I was just going to say, and because alongside of this, we're working on healing the gut. If we weren't healing the gut, then you are right to develop more sensitivities. But where they go hand in hand. It's not you get a test and okay, here you go. Bye, good luck.
Okay. This is boom. Here, Terry from YouTube is bringing up an interesting thing. Most testing suck. You're right. Sucks. I like SUX with an X and an exclamation mark. You're right, Terry. I tested negative at Epstein-Barr, just had massive shingles outbreak, right? So she's acknowledging that most testing are very inaccurate, but she's also bringing in the whole idea around infection and its impact on people's intestinal lining cells. So I want to point out something, which is that we are in an environment where most of us have some infection in our gut. And unfortunately, what happens is if you have an infection in your gut, you've all heard the term leaky gut, which means that a lot of people, the barrier between their gut and their blood lining and their blood flow is compromised. So as a result, what can happen is this whole porous barrier can cause a lot of food and infectious agents to go in the bloodstream that doesn't really belong there. So what has happened as a result of that is that this will cause a lot of things that don't belong in the blood to show up positive on these tests, causing everything to light up in false positives. So if a doctor or a functional medicine provider is doing the test and they don't understand how to accurately interpret or review the results, that is a sign of someone with leaky gut, which is a lot of overcalls, then you're going to still get the same bad advice. Oh, everything here is real. You should eliminate 90% of your diet, which is absolutely asinine, not true. So I love the fact that I'm training you guys on how to understand that some of these people with leaky gut pictures where everything is showing up, it's not true. And then what's real? What's not? Like, that's the thing that I think, having done 6,000 of these, I can really say, hey, this is how you tell a difference between the two. This is how you give someone really accurate, actionable steps that are clear based on their data. And yet out there, they just say it's all real. It's all real. It's all real. And then you make people super sick, eliminating 90% of food on the planet. So I want to ask you guys a question. What has been one of the most shocking cases or transformations that you've seen so far? I'm curious. I have a story. But Dr. J, I think you were getting ready to tell a story, so I'll have you go first.
Sure. Yeah. Thanks. I love this story, this case, because first of all, it involves a young child, a 3-year-old named Noah. And what I like about it is that we don't see really a placebo effect with kids, right? I mean, especially a 3-year-old. So the parents were very frustrated with their, general medicine. Little Noah had a chronic cough that was really rough and had I'm just going to call it a dermatitis or an eczema, but it just was really all over his body. It was dry, it was itchy, it was irritating. He wasn't sleeping well. I mean, he's just really uncomfortable. Poor little 3-year-old Noah. They had gone to allergists. They had gone to infectious doctors. They had gone to dermatologists. And essentially, I think between antibiotics, for the cough and probably, an inhaler of some sort, and then some topical skin, steroids, I mean, this is like general medicine treatment for this young little boy. And the parents just said there's got to be something else, right? So, we ran the testing, worked a little bit, with his diet, helped with digestion, and, eliminated basically for him, his big red flags were gluten and dairy.
That's it. Not everything.
That was it. It was gluten and dairy. And the parents jumped right in. The whole family eliminated gluten and dairy to make it easy for little Noah. And I'm happy to tell you that the skin cleared right up. I mean, he has just the healthiest skin ever. His cough cleared up. He's 4 years old and he's doing great.
I have an incredible story. Melissa, 20-year-old from Australia with POTS and dysautonomia, completely sidelined from her college career, right? And essentially, we did all the testing, and guess what it was? I mean, crazy. You think crazy. It was, and I have video of her getting this result, honey, and sitting behind her was an entire wall of honey buckets behind her They own a honey farm, a bee farm. That was the only actual thing that showed up. And within 2 weeks, her POTS and dysautonomia symptoms were gone.
It's amazing.
Right? It's healthy. It's honey, right? And she didn't have to eliminate anything else. It was honey, right? What about you, Kathy?
So I actually, we have a current client who had a big aha moment just the other night when we discovered that she was taking prometrium, which contains peanut oil, right?
Peanut oil. Peanut oil.
Peanut oil.
That's the other
Yeah.
thing is your medicines can actually have allergens in it. I was talking in a mastermind call, in a training call, talking about hormones with somebody. And I said, oh, are you taking this medication, prometrium? I was like, oh, that product is in peanut oil. And go ahead. What happened, Kathy?
Yeah. And so she said she wasn't even fully paying attention to what you were saying. And then all of a sudden was like, because she had just gotten her food mapping results back not too long before that. And it was like this huge aha moment. She's been going to neurologists. She's had numbness and rashes and pain and all kinds of things. Yeah, hives, and she's basically been dosing herself with peanuts every day.
Well, she said she was getting numbness on her lips and on her chest, and she'd been to the neurologist and had like $1 million workup for multiple sclerosis, all negative. So several years of this or months of this, and it turns out peanut in her medications, right? Mm-hmm. That's a dramatic story right there. Allie, what about you?
Not as dramatic, but speaks to the, if you're doing elimination, so there are certain foods that we know are historically allergenic, gluten and dairy being two of the top ones. And so it's easy to say, okay, without looking further, let's take that out since you're consuming that a lot. And so a client, Jack, who had a lot of like distended stomach and like a combination of constipation and diarrhea, snoring, like not sleeping well, really fatigued, weight gain. Yeah. And so didn't see a lot of movement, some definitely improvement after removing gluten and dairy. Mm-hmm. But then we did the test and peppers came up, bell peppers came up, oats and rice. And oats and rice, two things that are in a lot of the gluten-free foods, right? And bell peppers were something that he really prided himself on, having like a rainbow of bell peppers. And once he eliminated them, no more snoring, lost 15 pounds, digestion, so it was a combination of all of the things. Yeah. But it can be otherwise healthy foods, which you alluded to before. It could be mango. It could be broccoli. These are healthy things you're eating because as part of a healthy diet, they're not healthy for you. And this is a very bio-individual way to figure out what your unique body needs.
So Lisa Salazar right here on YouTube watching is bringing up a really good point currently in one of our programs. I want to speak to the accuracy of this testing and the genetics that happens, because when I teach this program, I actually teach also the genetics behind this. Mm-hmm. And basically, whatever you're testing positive to, each of your children has a 50% chance of also being positive to that. Check this out. Lisa says, my daughter played competitive soccer and struggled with debilitating asthma and could hardly play 10 minutes without a full asthma attack. After getting off gluten and dairy, asthma is completely gone. She's using her genetic data to actually make changes in her daughter's diet. That's a result of how accurate the testing is and how much genetics and you being educated on those genetics impact not just you. I say minimum 3 generations, a generation above you, your generation, and the generation below you. Wow, that's huge. I would love anybody in the chat right now to go ahead, and I would love for you guys to have any questions. Because the big question we just answered was, what's the big difference between the food mapping system versus just a standard old go and get some testing for food allergies or something? Any of you that's experienced the food mapping system, type it in chat. What the difference has been for you since you've experienced it. Let's have some user-generated responses to what your experience has been and what's the big difference with everything that you've done before the food mapping system and how the experience was different for you. Now, the other piece I have is dramatic stories around non-allergic food reactions that are digestive that many of our clients have experienced. This is even without the food mapping data testing. This is the food mapping system training around digestion. I'll give you a great example here. Inessa, for example, came into the program, tons of brain fog, tons of hormonal symptoms. She has shared this on social media, and she had her gallbladder removed, right? And didn't realize, and a lot of people come in thinking, oh, it's going to be my food allergies, food allergies. She got educated within the first week around digestion and started to realize that that history of having had her gallbladder removed completely lined up with the fact that her fat digestion sucks, and immediately started to support her fat digestion. By the time she even got her food mapping allergy results, about 50% or more of her symptoms were already resolved within like 10 days of actually learning about digestion and starting to implement. That has nothing to do with food allergies. That's part of your education in learning how to diagnose and deal with digestion problems that are causing food reactions, right? I mean, there are hundreds of stories of digestive game changers for clients we've worked with. I mean, do any of you remember any of these stories or transformations or have cases that allude to that? Jason, Dr. J?
Oh, I mean, I was just going to comment, yes to that. I think, just to kind of wax poetic on that, there are so many people that have gallbladder removals, in the United States. It's a common procedure these days. And then everything's supposed to be okay. And when you talk to the patients in the aftermath, I mean, you've done it, I've done it, thousands of people, and you say, did anybody chat with you that you might need that you do need some help with fat digestion? Your gallbladder's gone. Are you supplementing with X, Y, or Z? Are you taking that? And no, they're GI doctors. Nobody has talked to them about that. And these people suffer sometimes for decades. And then we just give them some fat digestion support. And like you said, in a few days, miracles. And it has, again, they keep thinking that they're allergic to these foods or sensitive to these foods. And it ends up being earlier than that. It's a digestive issue. So yeah, so many gallbladder cases.
So it's interesting, like before Kathy, you jump in, we'll come back to you, is like, okay, so like that gallbladder thing, I did a whole training around how, my God, how many people have had the gallbladder removed? And the underlying problem in the first place is they can't digest fat. And then they remove an organ that they needed to digest fat. And then they don't tell them jack about how to support the fat digestion after that organ is gone. To me, is criminal, right? So in many of my trainings, I was just talking about people are like, what's the one supplement that you can do to support your digestion, right? And this is why Digest It is the number one selling digestive supplement out of the store, and it's rebought over and over again because it works. And there's probably about, at this point, 50 testimonial videos of what a game changer this particular product has been. But to me, more important than looking at just product is really, it's learning the dire pure lack of education that GI doctors and surgeons have, and frankly, functional medicine physicians, nutritionists, and functional medicine doctors have. The lack of that digestion is causing people to react to food in non-allergic ways over and over and over again. And it's really traumatic and life-altering for people. So digestion has to be learned and addressed properly. Kathy.
Yeah, and actually this feeds in perfectly with what I was about to say, was that we'll have people come in and they'll say things like, I can't eat meat. Meat makes me feel awful, like I must be allergic to it. And no, they're not allergic to meat. In fact, they just don't have enough stomach acid, right? So once they start on something like Digest It, they're able to consume meat. And, for most of them, this is an important nutrient that they've been missing as far as some really good solid protein. So, and many of them are just very happy that they can eat a steak again.
And I just want to jump in real fast too on that too. Just like the gallbladder being removed and no counseling going on from the provider, so many doctors out there, I mean, 99% plus of doctors out there always think that there's too much stomach acid, too much stomach acid, too much. It's really feed, PPIs and all these acid reducing drugs. When the reality is, most people, when it comes down to it with testing, if we actually do some testing, are low in stomach acid. And that's why they're experiencing that problem with digesting meat and problems with feeling that fullness and that bulk, from eating. So again, it's just a lack of training all around. Like it's just a lack of training all around digestion and food.
Well, I'm going to actually bring up this point as an educational point. Everybody get ready to take some notes here, okay? So just thinking about the whole idea, one of the first steps in digestion is stomach acid. And you need stomach acid, what? To sanitize, right? We use vinegar to clean, right? So how important is that as a line of defense against infection? And then meanwhile, all of a sudden you're like, I get infections over and over again. And meanwhile, not even thinking, well, maybe my first line of defense with stomach acid is causing the problem. The other aspect of this is that when we experience heartburn, medical doctors erroneously think that that is from too much stomach acid, when it's actually a symptom of the opposite problem, which is too little stomach acid. And then here's the tickler, okay? Here's the tickler. Write this down, everybody. So when you go to the doctor with heartburn, they say, aha, too much stomach acid, when the real problem is low stomach acid. So they say, let's give you Nexium or Zantac or the red pill, this pill, to shut off the stomach acid, right? And maybe and then what happens when you completely turn off stomach acid? Well, you know that person that can't eat meat? Do you know that the most important digestive step to eating that meat, one of the most common symptom associated with low stomach acid is someone who can't digest meat properly, right? And even on top of that, do you know a lot of your vitamin and nutrients, talking about nutrient density here, back to the system, everybody, is that really critical nutrients like your iron, like your B vitamins, many of your vitamins, calcium, require adequate stomach acid to even absorb. And then we sit here and we're like, okay, well, let's say I have low stomach acid. No one told me about it. They put me on the purple pill. Now I have no stomach acid. And then now I'm not absorbing, let's just say your B12 vitamin. Okay, after months and years of this, low B12, guess what it causes? Those who are alumni in chat, type it in chat. Okay, insomnia, depression, anxiety, palpitations, neuropathy, chronic pain, right? Infertility, miscarriages. And then we go see the doctor for all those symptoms when follow the breadcrumbs, and it goes back to you have low stomach acid. That's just one step. That's broken, right? That's the education that I find so invaluable that I never got in medical school. That I mean, did we get this training? What I just taught you guys right now, did any of you get that training in your medical training or your nutritionist training?
Well, yes, in nutrition
Yes.
training, yes.
Yes.
You did?
That's why we help fill the gap here.
Yeah.
The doctors are screwed, man. I love that.
I was
And then we have
waiting for what Ali was going to say there.
Allie. All right, but so my whole point is that even I love what you guys just experienced here out there when you're watching. Did you learn something about that is completely out of the box, complete big aha moment that you have never heard from any of the providers that you've ever worked with? And are you all of a sudden making connections between food, digestion, vitamin deficiencies, and some of your symptoms that nobody can solve? Ding, ding, ding. Kathy.
And I just want to add, how many of you are being given all kinds of supplements and not absorbing them either, right? That's the other piece.
I love that one. Yeah. So how many of you, I called that the suitcase full of supplements. How many of you out there are taking a suitcase full of supplements, right? $500, $1,000 every month or two on supplements that you're not digesting, that you may actually be allergic to or may not. Right, that aren't even working, right? And I don't know how many people have had an experience where whole pills will even come out the other end. Right, that's a sign your digestion really sucked, right? I love that. Somebody's talking about how they have had some of that training. Lisa said, blew my mind to learn that my neuropathy that my doctors couldn't explain was caused by my digestion. Interesting case in point. How many of you guys know that diabetics, people who have diabetes, which is an autoimmune disease, by the way, are at higher risk for having neuropathy, nerve damage, right? And did you know, I'm going to tell you this, that this problem stems from, number one, people with autoimmune disease have less levels of stomach acid. So they already have that problem. But do you know medications that you're being prescribed by your doctors can also decrease the absorption of these vitamins? Like B12, is malabsorbed when someone's on the most popular medication for diabetes is called metformin, and that will further make B12 deficiency worse. And yet we're sitting here saying all these diabetics just get neuropathy, and the number one drug that we prescribe for diabetes actually causes B12 deficiency and neuropathy. Boom. Okay, everybody. So let's talk about, we're going to talk right now about, I love this. People are just jumping in. Someone like Terry says, we have a supplement graveyard. I love that. Jill says, Nexium for 20 years, keep increasing. Could be a big part of my 30 years of severe symptoms. Jill, we're putting a kibosh to that. Okay. So I want to talk about my food mapping masterclass, everybody. So my food mapping masterclass is a program we just launched in the beginning of January. And I wanted to add that. And it is taking the food mapping system that in the past we've only done in the main Transform program. We've broken that into a standalone program called My Food Mapping Masterclass. In this class, with all the instructors that you're seeing here, we all teach in that program. We're the instructors and nutritionists that you're working with. We absolutely train you on the digestion piece. You get the best testing for food sensitivities. You get the best training for understanding digestion and food sensitivity results from the best test. And this whole piece of histamines, understanding all the different pathways that histamines impact so that it is about all the symptoms you're having, not just allergic related symptoms, so that you can fill back your nutrient tank again. So guess what? That chronic fatigue, that brain fog, all these vitamins being low can be fixed. That's my food mapping masterclass here. And before we leave, I'm going to have each of their instructor is going to give us one parting comment on why you should work with us to get food freedom and food clarity. I'm going to ask them for that. And we're going to start with Kathy and Jason, and then we'll go to Allie. But if you want to learn more about my food mapping masterclass, here's a QR code that'll pop you over there so you can get the testing, get enrolled, get the testing done. And then you're going to be working with us live in this program to troubleshoot and get one-on-one implementation. And if you're in doubt, book a call with our team. There's a code to do that. So Kathy, what is something that you would say with why work with us to get food mapping clarity?
Because it's a whole system. It's not just a test. And ultimately it's in what you just said, food freedom and clarity, so that you can have certainty about what you can and can't eat. And more often than not, we're helping people add, like that's Allie's specialty actually, is helping people add foods back into their diets instead of, completely eliminating them forever.
That's a big point. Most people think they're going to go through some food testing and eliminate more foods. I'm going to ask you guys for percentage. How many, based on your experience, Allie, as our nutritionist, how many percentage of people are actually adding more foods back in rather than eliminating more foods?
100% of people. 100% of people. That is the goal. That is my goal. That is our goal collectively. Honestly, it's ultimately we want your body to heal and function optimally so you can bring in more food and have a more diverse spectrum of food that you can eat instead of eliminating all of the foods. That's always the goal. What more can you add in?
And Dr. J, you're one of the latest instructors to join our team. What would you say is why work with us?
Well, I just want to say ditto to what everyone else has said. But ultimately, having been a provider and been in the frontline worker for so long, the training's not out there. And I think, the testing is inaccurate for the most part. And I think what's really amazing about the food mapping system is that it, as Kathy mentioned, it's a system. We're taking into account, not just, stomach acid, but also pancreas health and liver gallbladder health and fat digestion and, balancing out the microbiome and, taking into account, lowering histamines. And again, using the very best test that's reliable and reproducible to get accurate results. And then also learning to read between the lines to pull out some extra data that really isn't taught anywhere, and I think it's so much bigger than just, I found some kit online and I'm going to order it and do a food test and then eliminate.
I've done that a million times, people.
Right. Yeah. It doesn't work and they don't feel better. And I think it's the system. It's taking into account that it's a whole system from start to finish, addressing so many different areas: digestion, immune system function, quality testing. Mast, histamines, et cetera. Yeah, it's just great. It's just not. There's nothing else. Honestly, I'm going to out myself a little bit. I I felt, let me use a different word. I felt super confident in my interpretation of food sensitivities. And, you and I had come to some of the same conclusions. Mine wasn't mapped out quite in the system the same way, but I have learned so much. My level of understanding has, 10x'd up in the short time that we've been working together. And I wish that for all providers, because I think people could get better care.
So here's interesting. We have before we jump to Allie, Tyler, 2018. It's been a long time, Tyler. Talk about Mr. Crohn's and couldn't tolerate anything. I remember this. And if you guys want to check out Tyler's story on YouTube, you guys got to check it out. What a remarkable recovery from literally heading towards surgery for his Crohn's that people said was incurable and he was going to possibly die from it, to total turnaround 2 months later. So proud of him. But he's saying like I think the number one reason that people should work with us on food mapping to get food clarity is because of results like this. If you have been hitting up against the wall, if you've been working with functional or medical providers and not getting results you need, and you need results like Tyler has experienced, total turnaround in his life since 2018, I think that to me would be the greatest reason is you want the results. I want the outcome, period. Allie, what about you?
Well, I was going to say that what I love about this program and really all the programs that we offer here at Transform is that you teach people how to think, not what to think, but how to think. And so that they can apply the teachings of physiology, like the facts of physiology, to their own body and for their own unique outcomes. And so I love that because you're teaching them, you're empowering them, and for long-term success, for sustainable results. And because I should add also, it's a combination of like this comprehensive learning, but also personalization, because I don't know that all online programs do that. It's a lot of like, here you go, here's all of the teaching. But then you're like, but I have a question. And how does this apply to me? And my situation is unique. And so we have a lot of one-on-one time, which obviously is like my favorite part. But we get to work with you one-on-one in the context of here's what you learned, and now ask your questions. And so it's the most comprehensive thing out there. I
think what people don't realize is that we're an online educational company. We are an online educational company. And one of the biggest lessons I've learned in my life is that I think that the only and best way that I've been able to facilitate my own health transformation has been through my own learning and implementation, and learning and implementation in a community setting where I've learned from every single patient and instructor that I've worked with over time. And as a result of that, what I've developed is an online educational program that's live, that's interactive, that's customized, that's experiences based, because I remember Melissa's story. I remember Tyler's story. Like people are like, how do you remember Tyler from 20? Because I experienced it with Tyler, right? And so did everybody else who was in that program that month, 2018 with Tyler. They remember Tyler's story. They remember he was Mr. Pancake Waffle Man. I know. How do I remember that? Because these are experiences. We don't learn by just going to watch a video or just reading a textbook or going 15 minutes to a provider. There's no learning there. So what is an online way with which in a community base, we create these experiences that are unforgettable, so that you learn how to implement, not just for you, but for your family, for the rest of your life. And that's what's the difference with working with us. That's what I do. I create unforgettable experiences in an online format with which people use their personalized data with one-on-one implementation to get outcomes that are impossible in a clinical setting. That's the difference. And with that, is that a wrap?
Yeah.
Mic drop.
Amen.
Boom. And ta-da! All right, everybody. If I would love in the comment section, give us some love. We got so many instructor here from Transform that so many of you guys have worked with. If you are somebody that have done food mapping with us, and whether that's through our main Transform program or through my food mapping masterclass, I would love for you to drop your experiences in chat. share your experiences. I love real people, real outcomes, sharing their real experiences. So if you could pop that in the chat, that would be incredible. It would be inspiring for somebody else to give them a behind the scenes look of what the results have been for you. All right, everybody, without further ado, that is a wrap. And if you want to learn more, if you guys want to talk to a member of our team, just to learn more about our different programs, go ahead and book a chat with our team. And without further ado, that is a wrap, everybody. I'm going to have everybody say goodbye and good night, everybody. Have a wonderful night.
Good night.
Night, everybody.
Bye, everyone.
Good night.
Nice to see you.